Hello and welcome everyone to the third session of the ICC Crack the Wellness Code Heart Health Forum. Without further ado, let me invite our speakers.
I'm going to dive directly into congestive heart failure. What is heart failure? So heart failure, essentially, as I said, there's not enough oxygen delivery to commensurate with the requirements of the tissues or the metabolism. And then the pressures can vary up or down depending on the kind of heart failure we have.
We should remember that one of the biggest reasons of readmission to the hospital is congestive heart failure. And coronary artery disease is one of the leading causes of death in men and women. Congestive heart failure means that the heart is not pumping strongly. The heart is a pump. Actually, there are two pumps. There is the right ventricle which pumps, and there is the left ventricle which pumps.
What is the effect of a COVID infection on the heart?
COVID affects every organ. We know that. Second, besides affecting the lungs, it definitely affects the heart in a big way, directly onto the myocardial cells, which is basically the actual muscle cells, and then indirectly by causing inflammation around the heart as well. And then it also does influence and make heart failure worse in a lot of patients that already have coexisting disease. And then 4 and 5, it also can propagate in many patients who have the risk of developing cardiac arrhythmias. The arrhythmias get worse. And then lastly, their lifestyle changes that sort of get hurt as well because of the declining overall health from COVID, fatigue, and so on and so forth. So those are the 5 salient points in this. And it also increases blood clot formation, which is very serious. Deep vein blood clots, and then also superficial vein clots and clots within the heart.
So the ABCs for treatment of congestive heart failure, coronary artery disease: A, aspirin, anti-anginal agents, and antiplatelet agents. It's a leading cause of death in men and women. Most risk factors can be modified. I cannot stress the importance of this. Stop smoking, treat high blood pressure, treat high cholesterol, treat diabetes. Catch the problems before it catches you. Know your risk factors, know the symptoms, modify your risks, discuss your risks of coronary artery disease with your physician. And if you feel you have symptoms, call 911.